Hi. Hi. This is Dr. John A. Rumberger. I'm Medical Director and Director of Cardiac Imaging at Corazon Imaging. The topic today is coronary artery calcification and ethnicity. Let's start with a case. This is a 49-year-old male, African American, who has a low-density lipoprotein, LDL, that is very high. His doctor has insisted that he be put on statins, but he's very reluctant to have this done. He also has a family history of his grandfather having a myocardial infarction at age 56. His physician discussed these issues with him and said, why don't we try to get a multi-detector or an electron beam coronary artery calcium scan to see if there is really an issue with respect to your risk. A local radiology center was offering coronary artery calcium scanning for $99, and the patient was willing to pay for this examination out of his own pocket and then follow up with his doctor and the report. Here is the calcium scan. Beginning up here is the sternum. This is ribs calcification. And this is the scan as we proceed down lower and lower. Here's the aorta, pulmonary artery. As we go down distally, we can see that there is an area of calcification clearly in the proximal left anterior descending area. There also may be an area over here, but the computer has very strict criteria, and that was not considered to be scored. So basically, he has calcification. If we look at this, it is in the proximal left anterior descending coronary artery and in no other coronary artery that we could find. The coronary calcium score is 31.19. It's considered to be mild in the range of calcium scores, which can go as high as 3 to 5,000, and highly unlikely to be associated with obstructive coronary artery disease. But as often in the case, we would also like to see his coronary calcium score in terms of the percentile ranking for gender and for age. This allows us to look to see if this is very premature for the individual or very latent for the individual, because as you know, the most important risk factor for all is age. Here's a graphical display of data that was collected from the University of Chicago in the latter 1990s using electron beam CT. And as you can see here, the rankings are the coronary calcium score clearly goes up as the patient ages. Now, this is the male group. There also are studies available for females, but for this particular individual, his ranking is at the 71st percentile. That means that he has a score that's roughly 10 to more years higher than the median for his age. Now, in particular, where do these data come from? Because it's very important to appreciate the source of your reference material. Well, this particular database was constructed in the mid-1990s from approximately 38,000 individuals, either self-referred or referred by their doctor for an electron beam CT coronary artery calcium scan in Chicago, Illinois. At the time, a screening calcium scan was offered to the public for anywhere between $300 and $500. That's a fairly hefty fee for a variety of individuals and not paid for by. Now let's just pause for a minute. Is there a difference between what we do today, which is multi-detector CT, or electron beam CT? Well, it turns out that there is no difference as long as we use modern 64-slice multi-detector CT. So for this individual, the scanning would have been the same had he been scanned in 1998 or at the same age in 2022. So we're not worried about the differences between the scanners. Important concern was raised at the time. These individuals from Chicago, Illinois, who could afford to pay for the scan, were largely Caucasian. So immediately then, individuals seeing this database said there might be a difference between ethnic groups. And what about the applicability between African Americans, Chinese Americans, or ethnic Hispanic? Now, that was the origin of a study that was called the Multi-Ethnic Study of Atherosclerosis, or MESA. This was conceived by the National Institutes of Health in 1998 and put into action in 2000. Patients were recruited until 2002 and then followed up. Now, there have been many publications of the MESA database since that time across a variety of issues. A total of 6,114 individuals were recruited across 6 centers in the U.S., recruiting people with no known cardiovascular disease as Caucasians, ethnic Chinese, African American, and ethnic Hispanic. 53% of the individuals were women. Here are the initial studies published from the MESA investigation in the New England Journal of Medicine, essentially indicating what we had proved in the past, that the higher the coronary artery calcium score in any given individual, regardless of their ethnic origin, was highly prognostic in terms of future cardiovascular events. However, one thing that the MESA study did show in terms of relative risk for the presence of any coronary calcium by ethnicity, in African Americans in particular, there was a 22% lower risk of detecting coronary artery calcium using the CAT scanner as compared to Caucasians, with less of an issue for Hispanic and Chinese. Interestingly, using the data from MESA, this patient's percentile ranking is actually much higher at 88th percentile when entering his data into a pure African American database. But is also somewhat different. If you're Caucasian, it goes from the 71st to the 80th percentile, and the Chinese 82nd, and the Hispanic 83rd. So in many cases, when we look at individuals above a certain percentile, in particular, the classic use is above the 75th percentile for this patient. Recall he was at the 71st percentile for the standard mixed database. However, he's at the 88th percentile in terms of an African American database. So that puts him from probably moderately high risk to high risk. I am not sure that these differences would make a major difference in my desire to be aggressive with risk factor intervention in this individual, regardless of ethnic background. But it does give you a pause that the given overall differences in cardiovascular prognosis between Caucasians and African Americans. Now, we also have, though, the ability to look at this by ethnicity. This is the MESA database, which is available online at the address noted above, and you can enter into individuals in terms of age, calcium score, their ethnicity, and then their other general risk factors. Yay, we have solved the problem.